been told by various departments that we will have a public consultation in February, so in a couple of weeks' time. And the consultation really goes on the back of a drug and alcohol strategy, looking at the use of cannabis both for medicinal purposes and also perhaps recreational use, and how those laws are then enforced. There's been big changes in the UK, and I know that the UK government's doing their own public consultation on medicinal cannabis, and the whole landscape is moving, because in America, where obviously you've had multiple states legalizing cannabis, you've now got far more observational studies, far more research being done into its use, both recreational but also for medicinal reasons. And I certainly think this is something that on the Isle of Man, with our health service, with our stable population, we could really benefit from.
You asked a question about this recently, didn't you, about the status for medicinal purposes of the drug in the Isle of Man. What were you told about that?
Well, you're quite right. There's been some pressure groups in the UK, particularly around certain conditions. The famous one was childhood epilepsy, where you do have some very, very rare syndromes whereby cannabis products certainly seem to be helping. And we know that one of the big pharmaceutical companies is developing a cannabis product specifically for this. In the UK, Sajid Javid, the Home Secretary, changed some of their regulations to allow specialists to prescribe cannabis products for certain conditions when nothing else had worked. And my question in Tynwald was whether those changes in regulations in the UK applied to patients on the Isle of Man, and the answer was they do. So at the moment, those specialists who we get coming across in the UK, for instance, neurology, and also some of the other specialists, can actually legally prescribe cannabis now for patients on the Isle of Man. The problem is obviously with the supply, because we don't have a ready supply of cannabis products. And one of the things that I really hope will come out of the consultation is, whilst we can use it for medicinal purposes, we can also actually start a homegrown industry using best evidence, using the best new techniques to actually grow it here for our own people and perhaps for export.
There have been stories about problems with access in the UK, though, haven't there? It's still very, very restricted, seemingly. A small number, or relatively small number, of specialists are able to do so. So it doesn't seem quite as available, maybe, as it could be.
I think you're quite right. The British government have taken an extremely cautious viewpoint on medicinal cannabis. They're very scared about diversion, about it being misused. When you actually look at the evidence from other jurisdictions, though, you've got places in Europe, for instance, the Netherlands and Germany, moving far more rapidly towards medicinal use of cannabis for a range of indications. You've got multiple American states relaxing their laws as well. And the risk of diversion, particularly into young people, is remarkably low. The risk of people using drugs and then getting involved in road traffic accidents is remarkably low and doesn't seem to be increasing. But what some of these studies have shown is actually the harm reduction, that people who at the moment might be taking strong painkillers, opiates for instance, are in fact using medicinal cannabis. So in America they've seen a reduction in deaths due to overdose in those states that have actually freed up their legislation to allow recreational and medicinal use. And so I think, particularly on the Isle of Man, with our good governance here, we can look at changing our laws, look at using different regulation to provide medicinal cannabis within a well-structured legal framework, which would actually protect people from these fears.
What about the recreational side? Because we have heard quite a bit over the last few months. The Chief Constable's annual report, for example, and other officers have spoken about the prevalence of it over here. It seems to be more people are driving under the influence of it as well. I think we've heard the term ubiquitous being used for the drug over here. You're a member of the Department of Home Affairs. What's being done within the department with regard to those comments that have been made by police officers?
Yes, I mean, certainly the comments made by the Chief Constable have been taken on board by the department and by Minister Bill Malarkey. Obviously, we have fairly strict laws on the Isle of Man regarding drugs, all sorts of drugs, and there are some major concerns about Class A drugs and the importation of heroin onto the island. But at the same time, the police are dealing with people who are found in possession of very small amounts of cannabis. Within the law at the moment, they're working within that, obviously, but they're trying to take a more pragmatic attitude in terms of cautions, in terms of getting people perhaps medical help to take them off of those drugs and get them off of any dependency that might be there. And then only really taking them to court and prosecuting them if all else fails, working within the law but also working within it with a pragmatic, humanitarian approach. I think one of the issues you bring up in terms of driving under the influence of drugs, that's different. Whether those are prescription drugs or illegal drugs, if you're not able to drive a car safely, you should not be behind the wheel. And what has happened, certainly over the Christmas period, is quite a few people were arrested and prosecuted for driving when they really shouldn't have been, whether it was due to drugs or alcohol. And I think that is a problem that people need to be aware of. I think people need to be far more responsible about their driving habits.
We've seen within the British Isles over the last few years, the likes of the Chief Constable within the Durham Force, and I think similar things are happening within Wales as well. They know that they can't change the law themselves, but they are working out how they can work within the current framework to change things. Is that something that's being done in the Isle of Man as well? They've said, for example, that, again, they don't want to prosecute small amounts. They refer people to medical services, and also not so much turning a blind eye to certain elements of cannabis use, but they're basically saying if people are doing this behind closed doors and it's all adults, then we're not really interested in pursuing that.
Yeah, I think it's a very interesting area to look at. We have laws on the Isle of Man, and I'm certainly not saying that the police should turn a blind eye here or ignore those laws. But I think the police are dealing with what they see as a widespread issue that in many cases isn't causing a problem. And therefore they feel a little bit restricted, that they're spending a lot of their time dealing with something that isn't really causing very many other people a problem. What we're seeing on the Isle of Man is people using best practice, best evidence. The Chief Constable from Durham did come over here to meet with the department and meet with the Chief Constable to share what he was doing and certainly see whether we could adopt those same sort of methods, working within our present law, but working better. Because what we don't want to do is prosecute and criminalise a large proportion of the population who aren't really causing any harm to themselves or anyone else, and who then have a criminal record, which can cause still some really major problems. If you have a criminal record regarding drugs on the Isle of Man, you can't take your kids to Disneyland, because if you apply for a visa to the United States, even though many of those states have now legalised recreational cannabis, you can't get through customs. And so I think that the police are very aware of that and are trying to do as much as they can to enforce the law in a sensible way.
Talking about treating it as a medical issue, this is something that the British Isles used to do, didn't it? Until, I think around the early 1960s, the British model was actually seen as a rather forward-thinking way of doing things, and then it's changed. So we're actually going, in a way, it looks like we're going back to something that's been done in the past.
You're quite right. The medicinal use of cannabis was highlighted by the Victorians. I understand that Queen Victoria herself used it for rheumatism and osteoarthritis.
But sorry, I mean also not just cannabis. I mean treating drugs as a medical issue rather than a criminal issue. So, for example, people who were addicted to heroin used to go to their doctor and be prescribed heroin and look to be weaned off it rather than criminalising them.
No, absolutely. And we've seen various projects around the world dealing with it in similar ways, in terms of people being able to be prescribed heroin as opposed to heroin substitutes when they can't deal without that drug. Certainly in Scotland, they've done some very, very good research about that and found it, if it's done safely, it can take people away from the criminal element. Because one of the issues that we perhaps don't have as much on the Isle of Man is the way that illegal drugs feed crime, that people commit crimes to get the money to pay drug dealers to get those drugs. And this can be a major problem in certain areas in the United Kingdom, and I wouldn't like to see that coming over here. But you can see that prohibition and the illegality of drugs plays into the hands of big drug dealers. We know that several of them from the United Kingdom are active on the Isle of Man, and so we have to protect our country from this sort of crime. And I believe that a more pragmatic attitude towards illegal drugs will help achieve that.